Knock, knock. Hello, my name is Alejandra and I'm going to be your student nurse today. Is it okay if I assess the newborn? Alright, awesome. So I would come in and wash my hands. I would uncover the baby to look at their ID band to make sure that I have the correct baby. Okay, awesome. So I will begin by listening or auscultating to the baby. So I will start off by listening to their lung sounds, doing that bilaterally across the chest. Any crackles would be appropriate. I will listen to the apical pulse for a full minute. That should be anywhere from 110 to 160. The respiration rate could be anywhere from 30 to 60. Then, after listening to the lungs and the apical pulse, I will listen to heart sounds. If there is a murmur, that would be normal during the first hours of a newborn. Then I would go down to the abdomen to listen to the four quadrants. After listening, I can then take the axillary temperature. That could be anywhere from 97.7 to 99.5. All right, and that's appropriate. I would cover baby back up and start at the head. So I would take off a hat or a cap that they might have. I would pick up the baby, make sure that I look at the posterior side as well. I would note the suture lines, fontanelles, and any molding, as well as any scratches or bruises that happened during the birthing process. I would note those or document. I would note the difference between caput succedaneum and cephalahematomas. For the cephalahematomas, that is bruising that can happen or pooling of blood underneath the skin. For caput succedaneum, it would be a swelling, which would make the head squishy. Then I can go down to the eyes. For the eyes, I would note that the corner of the eye is parallel to the pinna of the ears. That is appropriate on both sides. I would look at the eyes, making sure that there isn't any subconjunctival hemorrhaging, any jaundice, that there isn't any folds that could indicate an Asian baby or a Down syndrome baby. If there isn't any drainage, that is appropriate. I would look also at his ears, noting when I fold the ears that they recoil back up. That would be a term baby. I would then look at the nose, making sure that they have patency. So with one finger, I would press down on an ear and making sure that they can breathe with the other. Once I've done this, I can then go down to the mouth. Then I would don on gloves, and I would make sure that they can suck on my fingers so I could do the brooding reflex, making sure that they can suck and making sure I can palpate the palate. During my assessment, I can note any respiratory distress that they might have. There are 5 signs, which is grunting, retractions, nasal flaring, apnea for more than 20 seconds, and seesaw breathing. I could then go down, making sure that they have that range of motion in their neck, palpating for masses in the neck, as well as the clavicle, noting if there's any crepitus or any fractures. Going down, I could look at the abdomen, noting the shape, making sure that it's round and soft. I could then ask mom when the baby's last bowel movement was, when they last voided, when the last fed was. I would note at the umbilical cord that it's drying appropriately and that there isn't any drainage or redness. Could then open up the diaper, and I would note that this is a baby boy. He is circumcised. There's no foreskin. There is some rugae, so that would be a sign of a term baby. Making sure that there isn't any redness in the area. If this was a baby girl, I would know or describe the labia. For that, the labia majora and the clitoris, if they are covered, that is a sign of a mature baby. I noted rugae. I would also make sure to note that the testes are distended by palpating. For a baby girl as well, redness in the diaper or any drainage, white or red, would be appropriate and normal. If the diaper is dirty, I could then change it. I would go down to the legs, noting the skin color, making sure that they're pink, they're smooth, there isn't any vernix since they were bathed. There isn't any birthmarks, no lanego, no jaundice. Jaundice would be located in the head, the chest, the abdomen, the thighs, and the eyes. I would check for skin turgor, making sure that that's appropriate. Everything is good with the skin. We can move on to the legs. We can look at the bottom of the feet, making sure that they have creases on 2/3 of the foot. Making sure they have 5 digits on each hand and 5 toes on each foot. I could then do the Babinski sign. So from the heel of the foot, I would go up towards their big toe, making sure that it fans. That is a positive sign. I could do the Moros, which I would clap, and then baby would put their hands up and their fingers would kind of make like a C. I would push down on their arms to make sure that they can pull back up. That recoil. Okay. Then I would make sure to look at the back of baby. I would look at their spine to make sure that it's straight, that there isn't any dimples or hair on the bottom. That could be an indication of spinal bifida. That neck. Okay, and then after having baby unwrapped, it would be best to cover him up fast so that way they don't get too cold. I would ask mom if she has any questions for me, and that is it.